It is really my privilege to introduce our guest of honor for today, Mr. Dinesh Vasu, Minister of State for the Ministry of Culture, Community and Youth and Manpower. Minister Dinesh brings with him a wealth of experience from his years in public service, military, community sector as well. He was CEO of the Agency for Integrated Care, and he focused on senior care and ageism. I really like that. You see, it's like, that talks about me, senior care. Plus, he's had 15 years of grassroots and community volunteering. Ladies and gentlemen, please welcome Minister Dinesh Vasu.
Thank you very much. Thank you. So I just wanted to say thank you for inviting me, and this is indeed a very important discussion to have. You would agree with me that young children these days grow up in a very different environment to what we may have grown up in, and I say that, collectively, right? The environment is rather different. They tend to be on their phones a lot more, less interactions, and that then leaves them a lot more susceptible to, well, mental health conditions, addictions, and etc. Mental health, I think it's becoming a bit more prevalent these days, and a lot more abilities to detect it, a lot more understanding and so forth. And I will say this, as I said in many other fora as well. Maybe one of the reasons I'm here is because I also used to have a bit of mental health concerns, particularly after I was deployed overseas in a rough environment, and when I came back, a bit of post-traumatic stress. And it took a bit of time to, in fact, it comes back on and off, and you got to find ways to cope with it and so on. And I really like what Nicholas mentioned earlier of the fact that a lot of it is a long game, It's a bit like trying to get rich. Don't get rich quick, get rich slow. So you need to have a lot of interventions, and it's over the long haul. So I am fully aware that I'm amidst practitioners. You may have a lot more experience in running this, but perhaps I could offer 3 simple ideas that we could bring back and we could figure how best that works. First is the need for all of us to be connected, particularly with our youth. And so they're all in C's, C. So the first C is connectedness, and I think connectedness helps. It need not necessarily be a home environment per se, but networks where they can connect and they can find ways at which they can, engage with one another. The speaker was very kind to highlight my previous role in AIC, and I did meet, I was in charge of mental health, at least mental health in the community back then. And one of the organizations would connect with youth by going into certain, fora, internet fora, right, where they are nameless and faceless and so on, engage them, and then eventually bring them to, close groups for further discussion before engaging them and meeting them face to face. So that connectedness is indeed very important. The second C I would leave with the team would be the need to communicate. And I think here is where over-communication may sometimes help, depending on the context and the case. I refer to even my own children. I've got 3 children. All of them are pretty much teenagers now. And the technique to communicate with each of them, because they are different ages, would also be very different. So yesterday when I went back, my daughter, who was the youngest, 13, was in the room, and a bit quiet, so I just went there and plonked myself on the bed, and then I just said, I'm not going to move until we chat, so we just started talking and so on. So sometimes different, you know your children the best, you know the youth the best, the ones that you're dealing with, and many of them require some ways to communicate. I think it's inherent within. Not often it happens by WhatsApp alone, and sometimes a face-to-face conversation is very helpful because you can then observe what's going on inside by observing the way in which they're responding to you. The third C would be community. And I think many of the issues you're discussing today, you'll realize it's not easy for one particular agency or one particular group to do. And you need a community of practitioners so that you can engage as the mentor or as the person who's doing the intervention, you would need support too. And you'd also need to have certain additional tools, sharing of best practices, etc. So you do need a community to help everyone. And in a place like Singapore, where we are quite small and where everybody kind of knows one another, it is important to build that relationships that we get as part of being in a community. And here is where I think government does do quite a bit of work, be it in MSF or MCCY, and I think there are areas at which we can lean forward and support as well. But minimally, if nothing else works, you can always get in touch with folks like me, right, or people in the ministry, and we'll be very happy to help in whichever way we can. So I thought that would be one way that we can build a community with government and partners working together, because this is something that cannot be solved by one person alone. I know in Singapore sometimes there's a tendency to say, oh, this one, ask the government to do, government should do more, government should ensure, and so on. Government can't ensure much things. Very difficult for government to ensure. I mean, family also cannot ensure, then how government to ensure? So, but the best thing that government can do is to work with like-minded partners to find ways at which we can pool resources, get the tools ready, provide for some funding if that's required, and so on, in order to help you help the rest. And that should be the layered approach that we should take. So 3 simple ideas: the need to connect, communicate with one another, the need to be connected to one another, and the need for the community to come together to support our people. Ultimately, if we are able to get this across to our youth, and as what one of the speakers mentioned just now, as long as you can, as many people as we can, we try to save them and to help them in the best ways that we can. With the advent of medical technology, there's a lot more interventions that are available. The work on addiction, we were discussing it just now as well, has improved tremendously. I used to work very closely with IMH when I was in AIC as well. We used to have, but that was mainly for the seniors, but you will see parallels as well. And that will then, it'll be better directed towards the places where the needs are. So it's about connecting to get to where the patient may be, or the person who needs help, and then to utilize all the resources that we have to help to save and to try to allow them to then cope. So those will be the approaches that I thought would be most meaningful. I'm sure you may have spoken about some of this as well, but government stands behind all of you, and if there's anything that you need, do feel free to let any one of us know. And on that note, I wish you a very successful seminar, and I hope to speak to some of you later as well. Thank you very much.